Thank you, Claudia, and thank you very much for giving me the opportunity, inviting me to come speak at this meeting. I'd like to talk to you about some of the data that we've been acquiring over the last 5 to 8 years in cancer survivors and the response of them to acupressure. I have no conflicts of interest with this presentation. So overall, I'm going to talk about not just fatigue, but other co-occurring symptoms that happen in many cancer survivors. And then I'm going to talk about using self-acupressure as an intervention to try to help alleviate those co-occurring symptoms. And then I'll also talk about some brain imaging studies where we've done techniques to try to look to see in the central nervous system how these co-occurring symptoms occur, but also how they respond to acupressure. So taking a step back from cancer, there's a cluster of symptoms that occur in many, many patients that seek medical care. This symptom cluster includes things like pain, fatigue, definitely poor sleep, depression and anxiety, and also cognitive problems. What's interesting is that this symptom cluster can be caused by many different things. If you look in war and something that's Rose is going to talk about later about Gulf War illness, many survivors of war will have this symptom. Victims of childhood sexual or physical abuse also have a higher instance of these symptoms, as well as infections with certain viruses. And so it's becoming increasingly apparent that these symptoms really co-aggregate in individuals. And the NIH, the National Institutes of Health, has devoted a significant amount of money and attention to these co-occurring symptoms. So, in addition to occurring in fibromyalgia, things like irritable bowel and vulvodynia and other sort of pain-type symptoms, diseases, we definitely have this symptom cluster occurring in cancer survivors. We've been focusing a lot on breast cancer and breast cancer survivors. And just to give you some numbers, about 40 to 50% of them report pain of a chronic nature. 30% report symptoms of fatigue, about 20 to 30 with depression, but even at 40 to 50% report sleep problems, trouble sleeping or having non-restorative sleep. Of all of these symptoms, fatigue basically trumps them all. Fatigue is the one symptom that most cancer survivors will say is the most onerous, the most problematic to deal with, the strongest symptom that affects function. So how do you go about treating this symptom cluster? A patient comes into your office, they say they have these symptoms. Should you just focus on the symptom that they're complaining with right at that moment? Or should you try to capture the whole patient and treat all of the symptoms all at once? Or can you use an intervention that could target the whole symptom cluster? Overall, the approach has been largely to go piecemeal and to treat one symptom individually and then move down to the other symptoms. Also, it's interesting to note that the research that's gone into the symptom cluster has largely focused on one symptom. People are asking what's causing depression in cancer survivors, or what's causing fatigue in other individuals, or what's causing pain. We really don't have a good idea about what's at the root of the symptom cluster. So acupuncture, as June was telling us about, and he's done some very nice studies to show that acupuncture has been able to reduce many of the symptoms in the symptom cluster. So in aromatase inhibitor trials, June has been able to show that acupuncture is very effective at pain, fatigue, sleep, and depression. There's also been some post-chemotherapy studies as well that have been very positive. The average amount of reduction is modest, about 30%, and definitely you see smaller effect sizes with sham controls. What I'd like to talk to you about today is a different intervention that could be thought of as a complementary tool to acupuncture, and it's self-acupressure. And we thought that it might be beneficial to give patients the opportunity to perform the intervention on themselves in a way to sort of engage them in their own healthcare. So self-acupressure has some advantages over acupuncture. First of all, it's very low cost. Essentially, it's free once you've learned how to do it. It also requires minimal instruction. It takes about 15 minutes to train a patient to do the treatment on themselves. Once they have that knowledge, once they know how to do acupressure on themselves, they're able to control the dose. They can do it as much as they want. They can do it when they want to do it. So it really, really does empower the patient and give them a tool which they can use. It also reduces practitioner burden. I don't know if practitioners in Switzerland feel this, but definitely in the United States, there's this high burnout rate where physicians are overburdened with the number of patients that they have to treat. So this is a way of reducing some of that burden. It's also highly accessible to areas where there's no therapists. We've been developing an acupressure app, which I'll get to at the end, which basically can train a patient to do acupressure with a smartphone application. So that increases its generalizability. So we did a phase 3 randomized controlled trial of self-acupressure in breast cancer survivors. And this was a trial that was funded by the NIH and the National Cancer Institute. And we recruited breast cancer patients that were over greater than 12 months post-treatment. And they were randomized to one of 3 different groups. And here we're going to go on the relaxing and stimulating angle as well. So we had a relaxing formula which we thought would help improve sleep and improve restorative sleep. And we thought that would then improve fatigue in cancer survivors. We also had another acupressure formula which we thought would be effective at promoting alertness during the daytime, and that we thought would also help cancer survivors with fatigue. And then the third group was just receiving usual care. So they were basically given no additional treatments other than what they were generally doing to treat their fatigue. They did 30 minutes of acupressure over 6 weeks, followed by a 4-week washout period. And so we had a fairly large sample size, 288 individuals and almost 100 in each of the 3 groups. So what were our effects on fatigue? So this is plotting on the y-axis. Here is the brief fatigue inventory. In the gray area down here, this is normal levels of fatigue. So people in the general population have normal levels of fatigue, which are generally below 4. Most of our patients had fatigue that was above the general norm. And you can see that the two acupressure groups basically move the fatigue very significantly into the normal range. Both the stimulating acupressure, which is the black lines, and the relaxing acupressure, which are the red. And the usual care, there was very, very little change whatsoever in their fatigue, and it remained very high. And then into the washout phase, so after 6 weeks of the acupressure, they had 4 weeks of washout, and you can see that the effects mostly persisted throughout the washout, although it looked like there might be some rebound back here, but it was still definitely significantly better than usual care. Sleep also showed a similar finding. With sleep here on the y-axis, again, gray areas denote normal levels of sleep. You can see that most of our individuals had poor sleep at baseline, but the relaxing group specifically improved their sleep, whereas the stimulating acupressure group had an improvement in sleep, but not quite as good as the relaxing group. So what about the other symptoms in the symptom cluster? So you can see over here on this graph that many of the other symptoms are co-occurring in our individuals, and all of the symptoms improved with relaxing and stimulating acupressure. So here's pain. So this is baseline pain. After 6 weeks of acupressure, the pain is improved. Usual care has no change in pain, and then the pain reduction persists a month after acupressure stops. And you see very similar effects with depression, with relaxing acupressure actually outperforming stimulating acupressure for depression, and then also improvements in anxiety. So it looks like this self-acupressure intervention is able to target the symptom cluster. It's moving all of these symptoms that are considered to be problematic in breast cancer survivors. But what was interesting was what we just got accepted for publication was that the symptoms didn't improve in the same people. So if you correlate the improvement in fatigue versus the improvement in pain, or the improvement in sleep versus the improvement in pain, or the improvement in sleep versus the improvement in fatigue, you get basically no relationship. So even though individuals in our clinical trial are improving in pain and sleep and fatigue and depression, it's not the same people getting the same benefit. And we've been thinking about this, and that caused us to think, well, what's going on in these patients at baseline? What's actually causing their symptoms? And so to really understand the symptom cluster, we need to know the mechanisms within the symptom cluster. And long story short, we don't really know exactly what's going on with symptom clusters. There's some results that say that maybe chemotherapy, radiation, and surgery might play a role in the symptom cluster. There's some data suggesting that there's pre-existing conditions in some of these patients before they even undergo treatment that might cause them to have the symptom cluster. One of the major theories is that sickness behavior is called sickness behavior, and this involves inflammatory cytokines, which may be driving the cluster. And so the way the symptom cluster works is thought that during cancer, the tumor or the treatment that causes a change or an increase in inflammatory cytokines, which then act on the central nervous system and then gives us these symptoms of pain and gastrointestinal disturbances and fatigue and anxiety and depression. So this is what's thought of in general as what's happening with the symptom clusters. There's this barrage of pro-inflammatory cytokines, which June was talking about earlier, which may be driving the symptom cluster. What I've been interested in is the central nervous system in the brain, and we've done studies showing that glutamate actually acting in the central nervous system plays a really big role in chronic pain conditions like fibromyalgia, which actually also have symptoms that are very similar to cancer survivors. And what it looks like in chronic pain patients is that there's an elevation in glutamate in specific areas of the brain, and this glutamate spills out into extrasynaptic spaces. And then at later stages, what happens is there's a reduction in gray matter because you get excitotoxicity and you get a wasting away of brain gray matter. So if that's going on, we ask the question of, could we understand glutamate playing a role in the symptom cluster in cancer survivors? And we decided to do a clinical trial where we had 16 fatigued cancer survivors compared to 13 non-fatigued cancer survivors. And we were able to look at brain glutamate levels through a technique called proton magnetic resonance spectroscopy. So this is a technique that uses an MR magnet, and so the person's lying in the fMRI magnet, and there's a change in the magnetic field and the precession of protons in that field, and that yields a spectrum here with peaks and valleys. And what's interesting is you can ascribe an area in the brain and say, I want to look at the metabolites, which are these peaks. I want to look at these peaks just in that one area of the brain. So you can do that non-invasively with this technique of proton magnetic resonance spectroscopy, and the height of the peak is directly proportional to the concentration of that metabolite in that area. So this peak specifically right here is glutamate. So the higher the peak, the more glutamate someone might have. So we looked in our cancer survivors, and we actually did find that. We found that in cancer survivors that were fatigued, there's actually a higher level of glutamate than the non-fatigued cancer survivors. So that was interesting, suggesting that maybe there might be some excitatory activity in the brain that might be driving some of the fatigue symptoms that they have. Interestingly, we also found increases in the pro-inflammatory cytokines in the blood circulating through these patients as well. So that says that not only do these individuals have increased inflammation in the periphery, they also have excitatory activity going on in the brain, which could be driving some of these symptoms of fatigue and pain and depression and whatnot. But what was interesting was there was no correlation between the increases in IL-6 or the pro-inflammatory cytokines and the glutamate. So although these levels were increased in our fatigue survivors, there was no relationship between them. So that means that the sickness behavior model, these cytokines, which we think might be driving impacting the brain, we think that this model may not be entirely explaining everything that's going on in the cancer survivors. So what about looking at other things like looking at brain function? So there's a technique that also uses the MRI magnet, which is called functional connectivity. And in this technique, what you do is you look at how well different areas of the brain are connected or speaking with each other. And so with this technique, we looked in our sample of fatigued cancer survivors, and we found that the connectivity between this area in the inferior parietal lobule, the connectivity between this area and areas in the superior frontal gyrus were highly correlated with the amount of fatigue that these patients had, as well as they were highly correlated with the amount of sleep disturbance that the patients had. So this is also more data suggesting that the central nervous system is playing a role in the symptom cluster, but this is a different marker. This is looking at brain function. And I will say that these increases that we were seeing in the fatigue survivors were also not the same we're not strongly correlated with either the pro-inflammatory cytokines or the glutamate either. So this is a third outcome which we need to consider as playing a role in the pathology maybe of these survivors. So how might acupressure now go back and affect these outcomes which we're finding in the cancer survivors? So we had a small subset of our clinical trial. We had 9 individuals that had relaxing acupressure and 10 individuals that had the stimulating acupressure. And we did brain imaging on them to look at the functional connectivity, the strength with which different brain areas were connected to each other. And we looked to see how those changed, or if they changed with acupressure treatment. And remarkably, we found a very strong, striking difference between our 2 acupressure formulas. So what we found was that relaxing acupressure increased the connectivity between this network, which is called the default mode network, which is a network which is commonly activated when you're at rest, self-referentially thinking about yourself. So this network was more connected to the superior colliculus following relaxing acupressure. However, it was more connected to the bilateral pulvinar after the stimulating acupressure. And here on the bottom, you can see the actual responses of individual subjects. So what I've coded here is all the black circles here are individuals that got the relaxing acupressure, and all the white circles here are individuals that did the stimulating acupressure. And going on the x-axis, I'm plotting the superior colliculus connectivity to the default mode. And on the y-axis, I'm plotting the pulvinar or thalamus connectivity to the default mode. And what you can see is there's an exact bifurcation almost of the responses. So even though both of these treatments significantly improved symptoms in the cluster, so improved fatigue, they were doing it probably via different mechanisms. And so we went to the literature to look to see what the superior colliculus and the pulvinar might be doing in fatigue and in sleep. And what we found was that in animal models of the superior colliculus, they find that if you lesion the superior colliculus, if you go in and ablate it in the animal, you basically get no REM sleep. Whereas if you ablate other areas, REM sleep is just fine. So that suggests that the superior colliculus plays a key role in REM states of sleep. So what's the pulvinar doing? If you ablate the pulvinar, or if you deactivate, you actually get increases in low frequency EEG power, which is indicative of sleepiness. So it's almost like if you delete the pulvinar, the brain activity looks more like you're going asleep. So that suggests that there might be a need for sleep, whereas the superior colliculus is involved in sleep, whereas the pulvinar might be involved more in wakefulness. So there's this yin-yang counterbalancing between the alertness and the relaxing formulas that we're doing. So that's basically, the model is that the default mode network activity is more connected to the superior colliculus following relaxing acupressure, whereas it's more connected to sleep reducing or promoting alertness in the stimulating acupressure group. So what does this mean in terms of a clinician's perspective? So if a patient comes in and their primary complaint is, I really just can't sleep, I have really, really poor trouble sleeping, you might give them relaxing acupressure, which might affect the superior colliculus and might then promote REM-like sleep. What if someone comes in and says, my sleep is fine, I'm sleeping perfectly well, but boy, I'm just still fatigued. I have trouble staying awake. I have trouble staying alert during talks. So then you might say, well, then maybe you might be a good candidate for stimulating acupressure. So this is type of precision medicine, which hasn't been really investigated that much, but might be something to look at in the future. I'd like to end with my last slide saying that we've now developed a smartphone application which can be available on Android as well as on iPhones. And we developed this app to teach people how to do self-acupressure because we thought it would be really beneficial to disseminate this across many, many different people all over the world, hopefully, to reach patients that are in underprivileged areas with poor access to health group. So we had 6 focus group meetings with 8 breast cancer survivors over the course of about 6 months. And we now have ongoing trials of our app in ovarian cancer, lupus, and perioperative pain. And these are some screenshots of our app where we've got the relaxing formula here and a graph which shows you where to find spleen 6, for example. There's a relaxing music that you can play and listen to. And the app also allows you to track your symptoms over time, so you can see whether or not your symptoms are improving. So that app is called Me Time Acupressure, if you're looking for it. So it's called Me Time Acupressure. It's already available online if you want to check it out. All right, so for conclusions, it seems like symptom clusters occur in multiple clinical conditions, but in cancer survivors, it's a very big issue. Fatigue is considered to be the most troublesome and most bothersome of the conditions. It looks like self-acupressure impacts the cluster, which is very important. But what's interesting is it's not affecting the same people in the same way. Remember, some people that improve in fatigue didn't improve as well in pain, for example. And it looks like different forms of acupressure might be able to modulate the central nervous system specifically, and there might be point specificity for the acupressure formula that you might be using. And I'd like to end by saying that maybe self-acupressure might be a tool for personalized care in cancer survivors. And I'd like to acknowledge my collaborators. Dr. Susie Zick has been a collaborator with me over the last 10 years, and we've done some clinical trials that I talked about today of acupressure in fatigued and cancer survivors. I've been fortunate to have a lot of research assistants and collaborators, and definitely funding from many different institutes that have been that's been able for me to do this research. Thank you for listening.